best way to diagnose an obstruction in a blood vessel is to do a heart catheterization or the coronary angiography. But since that's an invasive test, we try to avoid that. There are other tests that indirectly give us an answer. The best initial test is a stress test, and there are different types of stress tests. For people who can walk on a treadmill, we do a stress test that requires them to walk on a treadmill, and it gradually becomes more difficult for them to walk. So we can get the information of how long they can last on the treadmill, what happens on the EKG tracings, or if they get any symptoms. Sometimes they need a more advanced testing, which performs the treadmill test, but we also acquire images from their hearts. With those tests, we have an idea about what is the likelihood of them having obstructive disease in their heart. But those tests have limitations. In general, their accuracy is up to about 80%. So depending on the scenario, depending on how many medical conditions the patients have, that may be adequate, it may not be adequate. And sometimes, if we have a very high suspicion of someone having very critical disease, we may skip the stress test because there is a very small risk of performing a stress test with someone who has an unstable problem.